If you're ready to unlock more better days, to take control of your health, to push past your limits and unleash your full potential, then you're in the right place. I'm your host, Dr. Jeremy Bettle. For over 2 decades, I've worked with elite athletes and high performers, helping them optimize their bodies, strengthen their minds, and recover from setbacks. Now I'm bringing that expertise to you through the Vitality Collective podcast. In each episode, we'll dive deep into the science, strategies, and real-world solutions you can apply right away. Whether it's enhancing your physical performance, avoiding or recovering from injury, sharpening your mental edge, or simply feeling your best every single day. With insights from top experts and thought leaders, this podcast is designed to help you take action, feel better, and live the life that you deserve. Welcome to the Vitality Collective podcast, where every day is vital. Welcome to the latest episode of the Vitality Collective podcast, where we explore the fascinating world of restorative sleep with Dr. Melissa Lim. Dr. Lim is a board-certified pulmonologist and sleep specialist dedicated to helping people optimize their health through better sleep. As part of Somnology and Redwood Pulmonary Medical Associates, Dr. Lim combines state-of-the-art technology with personalized care to address sleep disorders like insomnia, sleep apnea, and circadian rhythm disruptions. Her work emphasizes the critical role of sleep in physical recovery, mental clarity, and preventing chronic diseases. In this episode, Dr. Lim breaks down the science of sleep and its stages, sharing how they impact everything from athletic performance to creative problem solving. We discuss how poor sleep contributes to chronic illnesses like diabetes and cardiovascular disease, the bidirectional relationship between sleep and mental health, and the importance of consistency in your sleep schedule. You'll also hear about actionable steps to improve your sleep quality, the pros and cons of sleep tracking technology, and the range of treatments available for sleep disorders like obstructive sleep apnea. Whether you're an athlete, executive, or anyone looking to enhance your vitality, this conversation will give you practical tips to sleep and live better. Dr. Lim, welcome.
Thank you so much, Jeremy. It's absolutely thrilling to be here, and I'm looking forward to our conversation.
Yeah, me too. We were just catching up before the show, and I had to start really quick because we were about to get into the episode. Just you and I chatting. I think that's how passionate we both are about this topic, right?
Exactly.
Yeah, brilliant. Well, I alluded a little bit in that intro to some of the things I'm seeing around sleep now that I'm out of sport. And we had to sort of change the paradigm and the mindset in sport to really prioritize that as a really pivotal recovery tool for our athletes and our coaches as well, who had to make decisions in the moment, be very sharp for the game. Looking at high performers and executives outside of sport now, again, there's that mindset of we can compress the sleep opportunity to give us time to do more work, essentially. Why should people think about sleep as being a really important part of their day, not just an inconvenience?
Yeah, I mean, I think you touched on a lot of important things because, sleep had been ignored for many, many years. And I think sleep medicine is one of our newer subspecialties in medicine because we've learned that it really just isn't this passive time of unconsciousness, right? It's a very active time of regeneration. So it allows our neurons literally to get rid of cellular waste products. It allows us to, in the different sleep stages that occur in a given night, it allows us to secrete hormones that regulate our metabolism, that decrease inflammation, et cetera. And so all of these physiological processes we find are absolutely critical to maintaining and preserving optimal health and mental well-being. So now we're really learning so much every day about the importance of sleep and how it is a very proactive process and not a passive state.
That's fascinating. Thinking that this is the time that we physically recover. Can you speak a little bit more to that process you talked about in the brain? Because that's where I think I see a big need for this in, especially we sort of call them cognitive athletes, these high performing executives. What about the restoration of the brain is so important?
Yeah, it's again in athletics. I mean, you've seen this up close and personal, right? That athletic recovery is much better if you allow your athletes to sleep after a very hard workout or a hard game or match, etc. Their performance gets better, mental sharpness and quickness gets better. Great work out of Stanford under Dr. Ma, which showed that you can improve sprint times and 3-point and free throw percentages by extending sleep time for college
Right.
athletes. It's sort of really important seminal work. Um, but even decades before that, like in medicine, the sleep deprivation studies showed that interns and residents that were sleep deprived had emotional dysregulation as one of the first things that happened. Like you might be able to pick the right drug for a patient, but you were really mean about it, right? You were just not your patience was gone.
Yeah.
So I think that these are just important studies that were laying the groundwork for what we're learning now about the function of sleep, right?
Yeah.
So we have to also think of sleep as the different stages of sleep, right? Because sleep is divided into non-rapid eye movement sleep and rapid eye movement sleep. And then non-rapid eye movement sleep is divided into lighter stages and deep stages of sleep.
Right.
And it turns out that each of these stages probably has its own purpose, but we're really wanting our brains to experience all of these sleep stages. Deep sleep does go down in adulthood. School age children get a lot of it, but it does go down a little bit starting in adolescence, and then, but you should still get some as an adult. And again, each of these stages we're finding has probably a specific purpose for us physiologically. Um, and definitely REM sleep has been associated with improving creative thinking, creative problem solving, right? And in terms of your clients who are executives, what could be more important, right? You have to be able to solve problems creatively as
Right.
an executive of a company.
Yeah, I think both of those points, certainly modern leadership, emotional intelligence, and creativity in your decision making, and something we saw was accuracy of decision making in the athletes. Right? I would struggle to think of three more important things for an executive, for any leader, um,
Mhm.
to have as a part of their tool belt, which if removed, your effectiveness has just got to be absolutely shot.
Right, right, exactly. From clarity of thinking, problem solving, emotional regulation, because again, emotional regulation is also associated with making important decisions. Because if you are dysregulated, it actually is completely polar opposite of what you need to be to make a decision properly. Right, you have to
Right.
actually be regulated to
Right.
make important decisions.
Well, I mean, you hear about Warren Buffett, Ray Dalio, these big hedge fund managers who have had all this success in the financial markets, in the financial industry, talk about emotional control being the number one most important factor in their success. Right? They're not riding the highs and lows of the market; they're just making the best decision. So that's fascinating.
Yeah,
I wonder
that's
what their
right.
sleep patterns are like.
I'm sure it varies from night to night.
Yeah, yeah. And so can we talk a bit about those sleep stages? So
Yeah.
you mentioned different physiological benefits for each stage. You touched a little bit on REM. What about some of the other benefits that we see, or the other processes that happen during those sleep stages?
Yeah. For example, our weight regulatory hormones are secreted when we sleep. We know that some of our glucose regulation hormones are secreted during deep sleep.
Mhm.
And so certainly sleep deprivation, which deprives us of the various sleep stages, um, has been associated with an increased risk for type 2 diabetes, obesity and weight gain, obviously depression, anxiety, cardiovascular disease. Again, related to sleep deprivation as a whole, but as you drill down into the different sleep stages, probably affecting the different sleep stages differently, depending on
Right.
what hormones are regulated during which stage.
What comes to mind there is then, as we look at sleep, not necessarily just how long are we asleep, but then the importance of quality of sleep.
Yes.
So if our sleep's really fractured through the night, regardless of whether we get our 8 hours, we might be missing out on some of those key benefits from the various sleep stages.
Right. Yeah. So I think we should probably talk about sleep quality and sleep duration
Yeah.
a little bit separately. They are somewhat related because obviously sleep duration is important in terms of being able to go through all the different stages of sleep, because you go through all the stages in about a 90-minute cycle, right? So
Right.
you'll go through all the different stages of sleep 3 to 5 times a night, depending on how long you sleep. So there is an interplay here between quality of sleep and quantity of sleep, and both are important.
What I'd love to get into then is the sort of the acute effects first. Then you
Mhm.
mentioned some of the benefits and some of the physiological processes that go on. I know if I'm sleep deprived, and for me, sleep deprived looks like 5 to 6 hours.
Mhm.
And if that happens for more than one night, I'm starting to struggle, and its mental health is huge, exactly as you're outlining. First thing to go with me, I get this anxiety and
Mhm.
this feeling of like insecurity,
Mhm.
where you're just a little bit more sort of self-conscious, a little just not feeling quite as confident. Um, that's huge. And then Michelle and I were talking about this as well, and she was saying that the cravings, the appetite,
Yes.
everything seems to be
Absolutely.
different.
Yes.
What's driving some of that on the acute level, sort of in the days following a bad night's sleep?
Yeah. Well, if you think about it, if you're not well rested, what are you running on? Right? You're running on catecholamines. You're running on adrenaline,
Right.
cortisol, stress hormones, and all of the effects of those hormones on
Mm.
your body and on your emotions. Right. So you can see how there could be a direct correlation there.
Right.
Um, because instead of running on just being rested and calm, right, you're running on, that's just that it leads to the feelings of anxiety, right? If you're running on literally adrenaline
Yeah.
to get by.
Right.
Um, I mean, when we meet with patients, part of the discussion is trying to depathologize sleep for people, because although they know all of these things are important, because they know they're important, it can inadvertently drive some insomnia, because people then get nervous. Oh no, I'm not getting enough. Um, so we do try to tell me, yes, there are these acute effects that you should realize are happening when you don't get enough sleep, but that we can work together to change that. Again, trying to let people know that they're not alone. I mean, these are such common problems.
Yeah.
Um, that they're not alone it's really important for people to understand that,
Hmm.
and then that they can learn, right? That they can
Right.
learn to make corrections. But yeah, the connection really is literally at that hormonal level. And then for people who have obstructive sleep apnea, where there's periodic obstructions in your upper airway, we see fluctuations in oxygen levels, and that's
Mm.
another thing that drives the pathophysiology here. Because as our oxygen levels drop periodically, it promotes the production of abnormal oxygen molecules, which can be damaging to endothelial cells, which make up our blood vessels. Um, so again, the pathophysiology really gets down to both changes in oxygen, but also changes in these hormone levels
Hmm.
from sleep deprivation.
Those acute changes, I think
Well,
absolutely, and I found that with the athletes, when you start monitoring, they start worrying about it.
yes, yes.
I think the awareness that they are there is really important.
Mhm.
And so for me, it's taken a number of years to just be aware, why am I feeling,
Yeah.
insecure right now? And I haven't slept well for a few days. It's just a sensation. It's a feeling. It's being driven by this, and it'll be fine.
Yes, exactly. Yeah.
And then I think the thing we need to talk about then, from short term to long term,
Mhm. Yes.
um, you mentioned there, the damage to the endothelial cells, and you mentioned sort of the hormonal disruption, some of the different cravings, the different hormonal
Mhm.
makeups. Um, where does this start bleeding into that sort of chronic disease cycle, and what are some of the links between sleep and chronic disease, or I guess what are some of the chronic conditions that have been linked back to sleep?
Yeah, I mean, I think what I emphasize with patients is that the ill effects of insufficient and poor quality sleep are cumulative, and then the benefits are cumulative also, right? So again, we're trying to again emphasize, and this helps, I think, shift people's mindsets when they're coming to meet with us. It's like it's okay. The benefits are cumulative, so you're on the road to there. You're on the road. You're on the journey to better sleep, and you can do it. You can learn how to sleep better. Where that crossover is. It's hard. It's not like a specific time
Yeah,
threshold,
yeah,
because then you do probably have to play into genetics and epigenetics and things
right.
like that. So that's probably a complicated
Yeah,
it's a complicated concept, but yes, like maybe single night effects versus years long effects, right?
exactly.
So
Yeah,
um,
yeah.
we know that sleep deprivation may build up beta amyloid in the brain, right? We
Hmm.
know that beta amyloid is considered a potential causative factor of Alzheimer's dementia, right? So,
Hmm.
so again, there's going to be some accumulation of these detrimental effects that might push people towards developing some of these chronic diseases, but the direct cause and effect may not be that clear, right?
Yeah,
But you're increasing the risk for that. Um, again, sleep deprivation, increasing your risk for hypertension and coronary artery disease, neurocognitive decline, neurovascular disease, et cetera, obesity, type 2 diabetes, depression, anxiety. Um, eh, so there are both I think there are both shorter term manifestations of those problems and then also longer term cumulative um, development of those diseases that's probably enhanced by having poor sleep. Um,
yeah,
with depression and insomnia, there's a clear bidirectional relationship there. That people with depression have more complaints of insomnia, which is having trouble falling or
right.
staying asleep, right? And and,
Hmm.
and daytime dysfunction. And then people with insomnia then have worse symptoms of depression. So we know there it's bidirectional.
Yeah, yeah. Well, that's fascinating, and I agree on the complexity of this issue. I
Yeah.
always describe these things as, this isn't a light switch, it's a dimmer switch, right? So
Yeah,
it sort of happens
exactly.
progressively over time, that it's not, there's a point, 3 years in where, okay, now your sleep has caused this. I
Yeah.
think it's that complex mix of lifestyle factors, with sleep being a pillar,
Yep.
um, that contribute to this progression
Uh-huh.
into sort of a suboptimal state, and then maybe sort of starting to become sort of some of the pathologies that can be
Mm-hmm.
present. Um, and
Yeah.
I really think it's such a fine line we walk here. We chose Vitality Collective and not Longevity Collective,
Yeah.
because we want people thriving every day. And
Uh-huh.
so we want to stress the urgency of people taking care of their sleep and taking care of their nutrition.
Uh-huh.
And I think that's really, really important to acknowledge here, is that this is investment in your future self, as well as your short-term optimal performance, and just feeling vital each day.
Absolutely. Absolutely. I find that in my own practice, being a pulmonologist, I have a lot of patients that have some pretty serious diseases. But I think that what I have found in my own practice, that my patients, they don't really fear death, but they fear disability.
Right.
They fear disability. They want to
Hmm.
live a healthy life as long as possible
Yeah.
and have a good quality life. So we have these conversations.
Yeah. That absolutely hits the nail on the head for me.
Mhm.
I think, yes, we can give you 10 extra years. We can keep you alive and keep you ticking along for that extra 10 years. But that's not what we want. It's not what it's about. Let's have
Right.
those 10 years while you're thriving.
Mm-hmm.
Um, that's our emphasis. And I think this is such a way, and it's such an important way for people to create vitality in their life, is to have this rest and recovery built in as a pillar of their life and a pillar of everything you want to enjoy. This,
Yes.
along with nutrition, for me with the athletes, we had all of our different sort of subspecialties, but we had sleep and nutrition that underpinned everything.
Right. That's
Absolutely
so important.
everything was better with sleep. Everything. So, it,
Really important.
yeah.
Yeah.
Is there anything that it doesn't impact? That might be the easier question. We've
Oh,
gone all the way through.
yeah.
What does it?
You and I were chatting about this
Yeah.
recently, and I really can't think of one. I said maybe an acute appendix, right? Maybe there's like these acute medical illnesses that,
Yeah.
you know, didn't have something specific to do or causative in a causative sense, right, with your sleep pattern, but
Yeah.
but in terms of most diseases that we treat every day, whether, it's diabetes or hypertension, high blood pressure, right? Heart
Yeah.
disease,
Yeah.
cholesterol, weight issues. I mean, these are
Hmm.
things that sleep it's just such a vital part of
Yeah.
that. I couldn't think I couldn't come up with something unless you're thinking like something acute, right?
Yeah. Yeah. And even then, I bet if you had a good rest, you'd feel better.
Oh, well, okay. Inflammation, immunity, right? Healing.
Yeah.
So,
Yeah.
okay, it may not have caused your acute appendix, but if you want to recover from surgery, you better get some sleep.
Exactly right. Exactly right. And even that sort of weight control piece of this,
Yeah,
as people are looking
yeah,
to, you get people coming for training all the time. They're trying to drop weight. They're trying
yes.
with their nutrition. They're trying with their training, and it's sort of it's not going anywhere. They're not getting the gains or the progress that they expect. And
Hmm.
this could be one of the areas that I think people can really examine of, are they sleeping?
Yeah, absolutely. Because sleep deprivation, good studies will show that weight gain will be associated with sleep deprivation.
Wow,
So if you have
really
folks that are
interesting.
struggling with weight management, definitely, it's worth delving into their sleep patterns
Hmm.
in more
Hmm.
detail to see if that's a barrier, if that's an
Yeah,
obstacle.
yeah. I think we've seen in recent years a really big uptick in monitoring of
Yes.
sleep. We've got all the different wearables. Your watch will now tell you if you're asleep.
Mhm.
If you slept well, you've got the rings that'll tell you if you've slept well. Um, can you talk a little bit about the rise in that technology? Like, how is it telling you to sleep? People think it's heart rate, or they think it's measuring some sort of brain activity. What are we
Right.
actually measuring there with these popular wearables?
Mhm. Yeah, I mean, I think the wearable space has been really interesting, and in sleep medicine, it's definitely been impactful because now you have a pretty accessible tool to get a little window in on your sleep patterns. Um, so in terms of choice of wearable, I always, there are watches, there are armbands, there are rings, obviously, right? Um, and so in terms of choice, it really kind of depends on what it is you want to measure. So with sleep in particular, I think like Apple Watch, Aura, Whoop, Garmin, Galaxy, right? There are a lot of devices that will give you some idea of your stillness versus activity, and really that's actigraphy, right? Which is traditional, and it's very traditionally used in sleep medicine. We in sleep we have found it extremely useful to understand what somebody's 24-hour cycle of rest and activity looks like. And so having actigraphy so easily accessible on these wearable devices is great. I have patients that will definitely come in and show me their data off their wearable devices, so I can see kind of when their sleep period is. Um, the wearable devices in general are much better at detecting sleep versus wakefulness, um, versus distinguishing among the different sleep stages,
Right.
light sleep, deep sleep, and REM. But again, when you compare them head to head with polysomnography, which is the gold standard laboratory sleep test that includes EEG tracing, so we know what stage of sleep you're in. The different wearable devices, there's a little bit of variability among them in terms of correlation with a laboratory sleep study. But I always tell people just be a little cautious reading too much into the distinction among the sleep stages off a wearable device if it is not also on your head. Right? If it is not actually measuring brain waves, try to take it with a little bit of a grain of salt when it tells you deep sleep, sir. But I think the other really good analogy for people, though, is like, just because it may not match exactly against polysomnography, it's probably useful if you are pretty happy with that tool to use that tool for you to measure changes in what that tool gives you.
Right.
And the analogy in my practice would be people who have these peak flow meters for asthma. It's like a peak flow meter, one that one might get to monitor how good their breathing capacity is if they have asthma. It may not match very well against pulmonary function testing, something more formal. But it's okay because it has, if you know what a good day looks like for you when you blow a certain number of liters per second on a peak flow meter, you can at least monitor how you do with that same device day to day and week to week, right?
Yeah.
So they may compare that well across devices or against polysomnography. But if you have a sense of how it's monitoring you, that is something that you can find useful if you use that same device consistently. Does that make sense?
Yeah, a lot of sense. And I think that's such an important point to emphasize is people get very, very worried about like, oh my God, my device says I get no REM sleep or my deep sleep is basically nothing. I even found with one of the companies that changed their algorithm, same device, but went from an hour of deep sleep to 20 minutes of deep sleep.
Yeah.
It's just a change in algorithm. My sleep didn't change, but all of a sudden I was worried about my deep sleep. Knowing all of this, I've worked with several different sleep monitors, but there's something about tracking that data that is really challenging for people. And the first time I saw this was when I started monitoring sleep in sport, and we brought a company in to the nets, and everybody wore the watches, and it would actually give you a sleep or a readiness score, and it would do it sort of real time. And so you took people who were in an NBA schedule, they're playing their 82 game schedule. They're used to feeling a certain way, but now we started assigning a number to that.
Yeah.
And based on sleep and travel and all these things that were not going to change, now a guy's going into a back-to-back game, the second night of a back-to-back, and he's only a 40. And I told him he needs to be a 70. Yeah. So now the wearable is telling him how he should feel.
Right.
And that was never the case before.
Exactly. So now you've kind of gone over the top, right? From useful to detrimental.
Yes. Yes.
Because, I mean, it's important to monitor to a certain extent, but not too much, right? So what is that? And I think that threshold is different for different people.
Right.
I think for some people who are very, very prone to insomnia and are a little bit more anxious about their sleep and how their sleep affects them, it may not be such a great idea to be so drilled into your data.
Right. Right.
There is sort of this quantified self now, right? And people, are wearing these devices and wanting to know this data, and for folks that like the data, but know, kind of control its importance in their lives as opposed to making it too much of an authority. Yeah. That's probably the ideal person, as opposed to somebody who would read into that data to the extent that they give the data authority over themselves.
Right. Yeah, and I think that really lends itself to, why are you monitoring it?
Yes, exactly.
I think how we view wearable data, or any of the other data that we would collect on athletes, we would have GPS and body composition, all these different things. These were just data points to allow us to make longer term changes.
That's right.
If we saw that sleep was always really poor second night of a back-to-back when we brought them to the rink, it doesn't really change anything in that acute moment. It just means that maybe next week we don't bring them to the ring. We give them more sleep opportunity.
Right.
So I think people need to view their data more as a long-term behavioral guide than an, oh God, today I'm going to just perform terribly. Today
That's
I'm
right.
going to feel crappy. I think
Yeah.
that's the important thing, because we start looking at the watch and, oh, today I didn't sleep well, I don't feel good. My readiness score says I'm not going to feel good.
Right.
Versus waking up, checking in with yourself, oh, I actually feel really good.
Right.
Right? And then,
Ex-
oh, that's weird. My watch says I'm not. Go with yourself, how you
right.
feel.
Go with yourself. Go with yourself.
Yeah.
Yeah, I think the other analogy here that's kind of useful for people is when I say it's like when you cram for a test,
Yeah.
right? There's going to be a night of sleep deprivation, but you'll get through it.
Yeah.
You'll get through it. It's
Yeah.
okay. You crammed for a test, you took it, and now you can extend your sleep period, right? The following day.
Right. Right. Yeah. And so, maybe monitoring isn't for everybody.
That's right.
Everyone doesn't need to look at this in detail. I think that's okay. If you're not a person who is going to benefit from this, I think that level of self-awareness is going to give you much more benefit than having something tell you how you feel every day.
Right. Yeah, I would agree with that. I think one thing that wearable devices can do, which is like an assist, but not an overlord,
Yeah,
right?
yeah, yeah, yeah.
Is maybe
Yeah.
The wind down reminders, like, hey,
Yes.
your bedtime. You wanted your bedtime. You can program in, right, to your
Yes.
smartphone. You
Yeah.
wanted your bed to be 11 o'clock. So at 10 o'clock, you can set the reminder. Time to wind down for bed or something, so that okay, now it's time to kind of get off screens, do something relaxing,
Yeah.
switch gears.
This speaks to exactly that. We're using the data to drive lifestyle.
Right.
And I think that's the important thing. It's that the data doesn't just sort of change itself. It's the behaviors and the lifestyle that we work on consistently that actually improve those numbers.
Yeah.
So I think that's a great sort of segue into that
Yes.
component of this. And again, we were talking about this right before we got on here, is people have so much more agency than they think with sleep. What are some of the most important factors here that we should start to look for in our own behaviors?
Yeah, I think it's looking at the consistency, right? The consistency of your bedtime and wake up time. And the most important thing, if you're going to put something on a weighted scale here of importance, the most important thing is your wake up time.
Right.
Because if you stick with a wake up time, and I'm talking about wake up, get up, not wake up and linger in bed for 2 hours, right? Wake up,
Okay.
get up time.
Thank you for that specificity here.
Exactly.
Yeah.
There's wake up,
Yeah.
wake up when you get out of the bed. So there can be two
Uh-huh.
different things. But if you don't make that too big a difference, right? Like, okay, you hit your snooze for 10 minutes, but you're going to get up, right?
Right.
Very, very most important thing is your wake up, get up time.
Right.
And the reason is because that's what you can control. That's what you can control. You actually can't control when you're going to fall asleep.
Right.
So you can control when you put your body into bed, though. So the first thing is your wake up, get up time, because you can control that. You can set it with an alarm.
Yeah.
And then you have the ability to get out of the bed.
Yeah.
And
That's
then
questionable, but okay.
and then that helps to regulate your bedtime.
Right.
Because you'll start to develop kind of this natural sense of when you might feel tired or sleepy before that, before that wake up time. So
Yeah.
for example, if you set your alarm for like 7 a.m, and then you might start to feel a little bit tired or sleepy, 7 to 9 hours before that, which is for most people the amount of time of sleep that they need to feel really refreshed during the day. But you don't want to give yourself too long a sleep opportunity. In other words, you don't want to go to bed at 7. Let's say you want to get up in the morning at 7. You don't want to get into the bed at 7 if you're not going to fall asleep until midnight, because that doesn't help you. It just ruins what we call the sleep efficiency, which is how much time you spent asleep versus how much time you were lying in the bed.
Okay.
This gets back to the wake up, get up thing, right?
Yeah.
Because if you
Yeah. Yeah.
linger there if you linger there awake, again, you're ruining or decreasing your sleep efficiency because you're spending too much time in bed not sleeping.
Right. So
Um,
wake up, get up, just to sort of wrap that up. So wake up, get up should be within what, an hour each day?
oh yeah, in terms of like how much that should
Consistency.
vary.
Yeah.
Yes, yeah. I mean, again, we don't want people to be completely robotic
Yeah.
about their schedules, but something that makes sense, right? There's
Yeah.
like I'd say within an hour.
Yeah.
Weekends, weekdays, holidays, right?
Yeah.
Vacation. If you kind of establish a routine.
Yeah.
Routine, our brains love a routine. I have to tell you.
Yeah.
Well, when it comes to sleep, maybe not for learning, but when it
Hmm.
and learning new things, but when it comes to sleep, the brain likes a routine. If you think about it, that's how your brain is sort of learning when to deliver all these sleep stages to you.
Right. Right.
Right. So if you make that too variable, it's quite confusing, right? It's like, and the reason I say that is because typically we have our longest REM period right before we wake up in the morning. So if you make that
Right.
wake up time 6, 9, 11, 2, I mean, if you're all over the place,
Yeah.
um, when is your brain supposed to give you that last long REM period? Right? Because there's no routine there, right? So the routine is important in order for the brain to establish the distribution of sleep stages. Um, and then how much sleep one needs is, again, we want to get rid of the 8-hour myth and understand that the normal range is between 6 and 10 hours. And for most people fall in this bell curve between 7 and 9.
Right. Okay. So that's fascinating then. That really clarifies why the consistency is so important. I hadn't heard it explained like that before. That's excellent. And then I'd love to understand a little bit more about the efficiency piece
Yes.
because, I'm as guilty as anyone of the snooze, right? And sort of drawing out that wake up. And
Yeah.
you never feel great. Like, I don't know why you do it because you never feel good getting up, right? What's the importance, or I guess it could either way, what's the detriment of snooze, a little bit of sleep, another snooze, and sort of having that lack of efficiency, and on the other end, going to bed too early and not sleeping before going to sleep?
Yeah. I mean, because you know what, we have, this is an interesting thing that we don't have a lot of direct control over sleep quality, but what we have direct control over is sleep quantity, right? Is sleep opportunity.
Right.
So control the things you can control, right? So if I sleep quality will follow sleep efficiency. So if I focus more on my behavior, like when I get my body into bed and when I get my body out of bed, sleep efficiency will follow, and then sleep quality will follow sleep efficiency. Does that make sense? So you
Yeah.
start with
Yeah.
things that you can control first.
Right. Love that.
Yeah, and you start with the things that you can control first.
Yeah.
And people, it's completely counterintuitive. And I have this conversation all the time with my patients, right? When they have a bad night, so they try to go to bed really early the next night, right? And I
Yeah.
try to tell them, stick to the routine, stick to the routine.
Mm.
Let that sleep deprivation be your friend, because that sleep deprivation will increase the pressure to sleep the next night, and then you won't lie in bed awake, right? But if you try to like,
Right.
oh no, I slept badly, so I'm going to go to bed 3 hours earlier tonight. Um, if that's not your usual bedtime, it may or may not help you to be in the bed that much longer.
Yeah.
Or sleep in, right? I'm like, I slept bad. I slept badly. I'm going to sleep in till 10 because I slept
Mm-hmm.
badly the night before. So people start to wreak havoc with their sleep schedules. And
As a first time entrepreneur, I can confirm that people do that.
exactly. So yeah, exactly. The first thing that
Yeah.
goes is like, I'm gonna tinker with my schedule now, and then all of a sudden their sleep efficiency goes down, and
Yeah.
you know what I mean, and they get into a cycle of, insomnia is kind of an interesting topic in and of itself. We can probably have another discussion just on
Yeah.
insomnia, but it's one of our most common sleep disorders. I'd say, worldwide, insufficient sleep is our most common sleep disorder,
Mm-hmm.
but
Mm-hmm.
insomnia is like a close second.
Yeah.
Um, and middle awakening is a really common complaint that
Mm-hmm.
people have,
Mm-hmm.
as well as difficulty falling asleep. And human beings develop all kinds of maladaptive behaviors around insomnia,
Right.
maladaptive and also, mindset, right? Mindsets
Yeah.
around
Oh,
insomnia.
yeah, I can speak directly to that. I think our schedules in sport were so varied. You go from game day, home game day, you might be getting home midnight in bed at 1 o'clock. You might be at the rink at 8 or 9 in the morning, the following morning. And then after practice that day, you might fly somewhere. And
Yeah,
so you have an opportunity to get in bed. And then you might travel on a back to back. So then you play on the road and fly somewhere. And now you're in bed at 2 or 3,
yeah,
4,
yeah,
and so on and so on and so on. Um, and I, over the years, really started developing a lot of anxiety around sleep,
yeah,
whereby I would start getting really worried about not sleeping, which I found
yeah.
wasn't all that helpful for sleeping.
You
Right.
know,
And
it's
so now I'm nervous about the act of going to bed, and I'm laying there and I'm unable to sleep, and I'm getting more and more worked up the less I'm able to sleep because I know practice is coming the next day. Right.
yes,
So yeah, I
yeah.
resonate with that a
It's
hundred
it's a
percent.
vicious, it's an absolute vicious cycle, and I call it the
Yeah.
vicious cycle of insomnia, and it sets up really quickly, like a
Yeah.
couple nights in a row of not sleeping well, and all of a sudden you're in this like cycle, and I think the key is to recognize that that's happening as quickly as possible, so
Yeah.
that you can implement measures again that are in your control to try to break that cycle.
Yeah. Yeah. And I think, you mentioning insomnia,
Mhm.
that's one of the things you said, one of the most common conditions that you come across in your practice. What are some of the other conditions that you see, in your medical practice around sleep?
Yeah, so even as a specialty sleep practice, still we see our patients really are composed of the two most common sleep disorders, which include insomnia and obstructive sleep apnea.
Right.
Yeah, so that, I mean, like I said, even as a sleep focused practice, we see those patients the
Yeah.
most commonly. And still, I think they make up 95% of our patient population. But
Oh, wow.
but it, because we're a specialized practice, um, we also end up seeing many of the other sleep disorders like narcolepsy, circadian rhythm disorders, which are really
Mm,
common, like delayed sleep phase and or advanced sleep phase, which is something that happens as people get older.
right.
Some people. Um, so we see a lot of movement disorders like periodic limb movements and teeth grinding,
Yeah.
sleep related bruxism, and things like that. So we definitely see quite a variety of sleep disorders, but insomnia and sleep apnea still
Yeah.
the
And
the vast majority.
with sleep apnea, there's sort of central and peripheral, right? And can you sort of differentiate between those two for me a little bit so we can understand sort of, what are the mechanisms there?
Yeah, sure. So obstructive sleep apnea is extraordinarily common sleep disorder, um, and it's an obstruction of the upper airway, and the upper airway is really anywhere from the end of your nose, to your trachea, right, to
Hmm.
your main breathing tube. Most often, the obstruction is occurring at the base of the tongue.
Right.
Um, a lot of the myth around sleep apnea is that, oh, this is it's a male problem and you have to be a certain amount overweight
Mm,
to have it, or have a certain amount of thickness of the neck. And yes, that is a kind of a classic um, phenotype or figure of somebody who might have a description of somebody who might be at risk for sleep apnea, but it's a very broad population. I have a lot of postmenopausal females in my practice with obstructive sleep apnea, because menopause increases the risk for it. So there's family history, there's time of life, weight may have something to do with neck thickness, could have something to do with nasal obstruction. I'm now evaluating a lot of hockey players, interestingly. And if there's facial injuries and broken noses and people are mouth breathers, that promotes obstructive sleep apnea,
see.
because one of the purposes of our jaws, right, is to house our tongues. So
Mm,
if you're a mouth breather, you're losing the stability, you're housing, right, for your tongue. So more mouth breathing um, is from nasal obstruction, the higher the risk of obstructive sleep apnea.
yeah. Interesting.
So
As a rugby player, again, I resonate.
yeah, exactly. Um, and all these football players that do a ton of work on strengthening and thickening their necks, right?
Hmm.
There's a lot of weight then on the airway.
Right.
There's a lot of weight on the airway. So that's another thing that increases the risk for that. So you kind of like put all the factors together. It's like family history, facial structure. It is more common in men than women. Our premenopausal females are the lowest risk group, but you always have to think about it in every group because we
Yeah.
see it there. But then after menopause, the playing field is even between men and women on this problem. Um,
Another benefit of menopause.
oh my gosh, we could
Yeah.
sit here and name all of
Just
those
yeah,
benefits.
just listing the benefit. Yeah, yeah. And so what happens there during sort of yeah, we do get that. Yeah. What happens during sort of perimenopause and menopause then that levels that playing field?
Yeah, I mean, like definitely, the sex hormones, estrogen is a big part of it. We know that hormone replacement therapy, which is becoming a little bit more popular again because some of the risks were a little overblown. In the recent past.
Hmm.
Um, uh, Hormone replacement therapy decreases the risk, so that kind of gives us a little bit of a window in on causality.
Right.
So again, not the whole picture, but I have a lot of kind of normal weight female patients that are in the menopausal transition or postmenopausal, and some of them have really severe cases of sleep apnea.
Hmm.
Um, so it's just a really interesting and kind of
Yeah.
fascinating transitional life
Yeah.
event.
Yeah, it is, and I think that people find that really validating, who may struggle with this and sort of not understand why.
Yes,
So that's a
exactly.
really, really great piece I'd love for us to emphasize and really help women going through this sort of midlife period understand that is a natural process associated with what they're going through.
Right, right. So
Hmm.
when you have poor sleep, which again increases a lot during the menopausal transition, there's much that can be uncovered there that would help people.
And is this a treatable condition?
Absolutely, yes.
Yeah.
There are the different treatment options for obstructive sleep apnea. CPAP or continuous positive airway pressure, which is kind of and a lot of people are familiar with that now, right? It's usually it's airway pressure that's air pressure that is delivered usually by some kind of mask, something that goes over your nose or nose and mouth or inside your nostrils, and it acts like an airway splint to kind of to keep your airway open.
Right.
It's very effective therapy, whether you're mild, moderate, or severe, because it treats you at the beginning of your airway, which is the end of your nose.
Hmm.
So it actually it ends up opening your entire upper airway.
Interesting.
Um, not everybody tolerates CPAP, right? So we have other alternatives. It turns out that the GLP-1 agonists now can be effective in decreasing obstructive sleep apnea. So weight loss is one of the single most effective interventions if
Right.
one has a weight-related case of sleep apnea.
Yeah.
There are dental devices that sleep dentists can make that stabilize your jaw and your tongue in a more forward position,
Hmm.
which opens the airway. There's a whole range of surgeries that our ear, nose, and throat surgical colleagues can do, from correcting deviated septums to
Right.
decreasing turbinates to taking out tonsils to again advancing the jaw. There are these pacemaker devices now for the tongue,
Interesting.
whereby it's an implantable device, right? Where one lead goes to the diaphragm to detect when a breath is being taken, and the other lead goes to the genioglossus nerve, which controls your tongue and then pushes your tongue out of the way.
Interesting.
So we have a whole like kit of things that we can do, from lifestyle things, right?
Yeah.
Weight loss, avoidance of alcohol before bed, side sleeping,
Yeah.
etc. But there's a lot of like lighter things that can nasal dilators, lighter things that can be done put together to be effective treatment, and there are gradations of invasiveness.
Yeah. And I think I spoke with one of my previous guests about this, the personalization of medicine and that sort of directionally being where we're going.
Absolutely.
The importance here of sort of differential diagnosis of what specifically is causing your sleep apnea.
Yes.
I might need surgery. Someone else might need a mouth guard at night,
Yes. Yeah.
right? That's really simple. I think funneling everybody into one modality or one treatment, I think could be again a real cause for anxiety. People might avoid seeking out treatment because they think, well, I don't want surgery,
Right.
and it might be something really simple for them. So I think understanding that people have options
Exactly.
is so important.
Yeah.
And where
Yeah.
can people go? Like, who should people be looking to get this treatment from? Because
Yeah.
I think it's a seems like a specialized area, and
Mhm.
they'd want to talk to somebody who really, really understands the issues here.
Yeah. So I mean, I think we're a little bit biased, of course, because we have a sleep practice. But you can start with primary care and get a referral to a sleep specialist. A sleep specialist is likely to have a broader view of your treatment options and may be able to personalize your treatment recommendations
Hmm.
more than if you go directly to a specialist.
Yeah,
That's that might just if you go directly to a surgeon, they may consider the surgical options
yeah,
off the bat first. That's okay. Some people are very surgically oriented, and
yeah,
they kind of want to go towards more invasive interventions. Um, but I always tell people and that just could be a personal preference, right? And very very appropriate. But I always tell people the one thing that surgery can't cure is aging, and aging is one of the risk factors for obstructive sleep apnea. So if it is something that you choose, don't forget to follow it, right? Don't forget to follow because over time, this disease, obstructive sleep apnea, can come back. You did mention central sleep apnea, and
yes.
I wanted to
That's
make
where I was
sure I
coming back to.
oh, good, because we're on the same page.
Yeah,
I just wanted to make sure that I wasn't, I wasn't ignoring that question too. It's a
yeah.
much more complicated question. Central sleep apnea is when your brain does not cue your respiratory system to take a breath, to take a
Wow.
breath. Um, and the reason that can occur can be multiple, right? It can be medications like opiate pain medications can decrease the cue to take a breath. Um, Heart failure, like a weak heart muscle, can do it. Strokes can do it, right? So when we see central sleep apnea, we always think, what's the cause? Because there's usually something that's causing it. Um, Interestingly, there's a weird thing that we see happen fairly commonly now that when we initiate CPAP on a patient, there are some people that have an initial period of central sleep apnea is kind of caused or induced by that CPAP machine. Um, so we have to like when we see that happen, we have to make some adjustments in the pressures and give the person a little more time to acclimate. Um, but again, with central sleep apnea, the focus is on what's causing the central sleep apnea. Um, it is rare for it to be a primary disorder. There are rare cases of that, but it is extremely rare for it to be a problem that does not have another cause.
Right. And so it would be a treatable condition. It would just be treated by that primary driver of the that's more of an
Ex-
outcome, I guess.
exactly. Figure out what the cause is. Figure out what the
Yeah.
cause is, and focus on the cause.
Right, right. And so I think it's so important to acknowledge these issues that people can legitimately have. But on the other side, I think people searching for these can cover up what for me are some of the most important areas, and that's your behavior.
Yeah.
Do you have your phone by your bed vibrating and buzzing and giving you
Okay.
notifications all night? Do you have, a TV in the bedroom? Do you have the light? Is there a lot of light coming in? Is it too hot? Does your cat attack your feet all night? Right?
Yeah.
Again,
I say
speaking
that
from
sounds like
experience.
that seems awfully specific.
Very, yeah, strangely specific example there. Yeah. And so can you speak to some of these sort of sleep hygiene issues that we see a lot, that we can
Uh,
clear up a lot of disruption just through setting up our environment and our behaviors around sleep a little better?
Yeah. The public awareness of the importance of sleep has gotten a way, way better like the last
Right.
several years. I mean, And if you ask the general public, do they know that sleep is actually important for them and that's regenerative, right? And not just as pet, they'll say, yeah. So the majority of people actually know that it's important. So there's a big gap between people who know, like they have some education or an awareness, and what they're implementing. So how do we close this gap between, like, this knowledge gap, right? It's not just they have the knowledge, but they haven't changed their behavior yet. So how do we start to narrow that gap a little bit? We have to look at the things that are, again, blockers. What are our blockers? Our usual blockers are lifestyle. So too much work, right? And we're giving importance to work, right, too much in our lives, right? And we're like, if I just slept an hour less, 2 hours less, I could get X amount of stuff more done. And again, how do we reframe that to, I can work more efficiently and think faster and more clearly and be a more creative problem solver if I didn't sacrifice my sleep, right? So you have to, like, reframe how you think about these things.
Yeah.
And then, so lifestyle for sure, like lifestyle getting in the way of lifestyle, right? Of behavior changes.
Yeah. Yeah.
And then you have technology, which, we all love our tech, but, I would encourage people to look at, blue light filter, apps and glasses and, screen covers, things like that might reduce the amount of blue light exposure, which decreases melatonin production, which and melatonin helps to cue our brains that it's time to go to sleep. And then, so those are some of the major, two of the major things that kind of get in the way of our ability to close that gap between what we know and what we implement. But in terms of the other lifestyle interventions that we can do, sometimes, I don't know, have you heard of stimulus control therapy? Stimulus control?
I haven't. Tell us about that.
It's actually a behavioral, in sleep medicine, right? It's actually a behavioral prescription, right? That you can give people, like, you can follow these guidelines in stimulus control. And interestingly, they're all like lifestyle things that you can do. If you follow these 5 things, a lot of times your sleep your sleep issue will get better without having to do anything more. And that's what's so fascinating. And it's ultimately, the idea behind it is that you want to decrease the association between your bed and not sleeping.
Right.
So if you can just, try to keep it in mind, there's really only a few things that it is, right? It's basically getting into bed when you're sleepy, right? So going into bed when you're sleepy, when you feel, okay, now it's time, right? I need to go to bed. Getting out of the bed if you're not sleeping. So more than 15 or 20 minutes, if you're lying awake, then you get up and you go to a different room and, do something else besides lying there struggling. Reserving the bed in the bedroom for sleep or intimacy, right? To keep a regular wake-up time, which we've talked about, the importance of that, wake-up, get-up time, and to eliminate napping. And it's not that napping is bad, and we should spend a couple minutes talking about napping and the benefits of napping. But if you nap to the extent that you're replacing your nighttime sleep, that can interfere with your ability to sleep at night.
Yeah.
Right. So that's why I say that's my caveat around napping, because even though it's part of the 5 steps of stimulus, the 5 components of stimulus control, there's a little caveat there, right? Because napping can have some benefit, but if one has a tendency towards insomnia, then we would eliminate that daytime nap.
Right.
So it's really those 5 things. And sometimes when I just give that to patients like an actual prescription and they follow it, I have a lot of patients that said that I hadn't even heard of that. They were like putting all these things together, and they'll come back and say, I'm better. Like, so you want to implement them before you've developed that vicious cycle that you and I
right.
about. Yeah.
Yeah, and so simple.
I know.
That's the thing. I think we overthink so much of this stuff. Like, I need some technology, or I need something, a medical intervention, when it really is just daily lifestyle behaviors and consistency in those behaviors that are really going to drive your success here.
Yeah, it's see how it's there. It's everything that's in your control. Like, it's everything that's in your control. So that's an actual prescription for like the first level prescription that I like to talk to patients about who might be struggling with insomnia or early insomnia, or they something's going off there. But in terms of other sleep hygiene things, there are some other things to recommend. As you were alluding to, the temperature of your bedroom, we usually like a cool, dark environment to help promote sleep. It turns out that there are these interesting studies that if you keep your head cool, that you get into a deep sleep more efficiently, right? So that's sort of an interesting kind of idea that you can keep your room a little cooler. Um, Avoiding alcohol too close to bedtime, which can increase your risk for obstructive sleep apnea. And then as the alcohol wears off, it becomes like a paradoxical stimulant. It sort of interrupts your sleep architecture
Right.
When it wears off. And then, again, the technology, looking at when your last caffeinated beverage is, right, and making sure that it's at least 8 hours before your intended bedtime,
Right.
and preferably even earlier.
Yeah. Yeah. Again, very simple, very
Yeah.
practical. Thinking about these things that are going to disrupt your sleep. For me, noise is another one.
Oh, right. Yeah.
Like these things that I I must look ridiculous when I go to bed. I've got my nose strip, I got my earplugs, I got my eye mask,
Yep.
and so I think those are just some factors that I know I can control
Mm-hmm.
to sort of stabilize my sleep and just create the environment that I want. We keep our bedroom quite cold, in the 65-ish range. We did recently kick the cat out of the bedroom and keep her locked out, so that's a really important step for us.
I have a really funny little anecdote on cats and sleeping, because one of my patients who wears CPAP said that and it's pretty significant, his degree of sleep apnea, that he woke up in the middle of the night recently because his cat actually turned off the CPAP machine because she wanted to be fed.
See, I
And
knew they were evil.
right. So this is very funny to me because it's not something a cat can do by accident. You actually have to put a little weight onto your paw to turn that button up.
They're evil. They're pure evil. I
Right?
swear. Yeah.
You think, do you think she's trying to kill me? And I'm like, I can't go there, but she was hungry. She
Yeah.
wanted your attention. She knew how
Yeah.
to get your attention.
Yeah. They know what they want and they know how to get it.
Exactly. She put a little weight into that paw.
Amazing. Amazing. Well, I don't think we can top that story. I think we'll wrap up there. Um, I'd love for people to be able to find a little bit more about your work, certainly with somnology.
Sure.
This we've been quite deliberate to not talk as much about that because we don't want this to come across like a paid ad. But we work with somnology
Okay.
through Vitality Collective, and with all of the technologies, the resources, everything that we've pulled together, it's been about the people,
Okay.
and so we could have gone a lot of directions with our sleep studies, and we specifically chose somnology because it's the highest degree of medical verification of the technology, absolute best technology, but then the follow up from the people who's reading the report,
Mm.
right? And we've done that with diagnostic imaging, with blood work, all these different things. It's the people that are interpreting the data. And so I'd love people to learn a little bit more about your work and be able to get in touch.
Great. Well, thank you so much. That's really nice of you. Yeah, so somnology and the sister medical practice that somnology kind of sprung out of, we all work together to provide people with technological tools and clinical follow-up, right? Clinical interventions together. And the technology angle on this is that we are not just, we don't have to say device agnostic, we say device inclusive.
Right.
We are not a device manufacturer, but we spend a lot of time vetting various devices on the market, and try to get a better sense of their use cases so that we can implement them for our business partners, but also for our patients, and understand which ones are the best choices in which clinical situation. So we help our patients make the choice of different devices, but we do not manufacture devices. We're very software oriented, right? We want to grab that data from whatever source it comes from, but it was at least a trusted source because we vetted the device. and the data that come from the device, right? We take that data and then we generate custom reports for people about their sleep. We are implementing a little bit of this artificial intelligence tools, which allow people to rate their sleep quality, and then we'll take it a little bit further and be able to give people some insight into sleep patterns that are being detected, right? And those impressions are actually clinically validated by sleep specialists. So we're not just, so on the somnology side, we've again integrated the care piece of this. So it's not just a chat bot, right, that you're having an interaction with, but these things are being vetted by human providers. Our website, which we're happy to share, or you can share as well, Jeremy. So it's somnologymd.com. And then our medical practice is redwoodpulmonary.net. Excellent.
Well, again, thank you so much. We really appreciate you being on. And our listeners will have got so much from this conversation. So many practical tips here and deep understanding. So thank you so much. And
thank you.
This has been fantastic.
All right, it's great. It was really fun. Great to chat with you again.
Thank you for joining us for this insightful episode of the Vitality Collective podcast. I hope you found our conversation with Dr. Melissa Lim as fascinating and practical as I did. Remember, sleep is not just a nightly routine. It's a cornerstone for your health, performance, and vitality. Here are 3 actionable steps to help you start improving your sleep tonight. Number 1, set a consistent wake-up time. Stick to a regular schedule, even on weekends, to help your brain regulate sleep stages. Number 2, optimize your sleep environment. Keep your room cool, about 65 degrees Fahrenheit or 18 degrees Celsius, dark, quiet, and free from distractions such as electronics or pets. And number 3, adopt stimulus control therapy. Only use your bed for sleep or intimacy, and get out of bed if you're not falling asleep within 15 to 20 minutes. Avoid napping for more than 15 to 30 minutes, and especially the closer you get to going to bed. Before we go, a quick reminder. The content shared in this podcast is for informational purposes only and does not constitute medical advice. Always consult your physician or a qualified healthcare provider about any questions or concerns related to your health or medical conditions. Thank you for listening, and if you enjoyed the episode, don't forget to subscribe, leave a review, and share it with someone who could benefit from better sleep. Until next time, take care of yourself and sleep with intention.